COVID vaccine in our kids, necessary or not really? Let's back up here. My name's Dr. Amna Husain, board-certified pediatrician, board-certified lactation consultant, and mom. Today we're going to be talking about the COVID-19 vaccine and its recent approval by the FDA for adolescents, aged 12 to 15 years of age. Likely down the pipeline, we might even see younger children be approved. As a reminder, this data is up to date as of May 11, 2021. So whatever changes might come since then, we won't be really able to address those in today's video. Today I want to talk about the vaccine and if it's really warranted and needed in our teenagers and our adolescents. What you're thinking, pediatrician, of course she's going to be pro-vaccine. But there are moments where we actually do weigh the risks and benefits versus the age and the actual disease profile in the child, whether it's even warranted to vaccinate the child. For example, the rotavirus vaccine. We typically don't vaccinate children for it after 8 months of age because it just doesn't pose as much of a risk at that age group. There's other viruses out there as well that we can vaccinate against, like rabies virus. We don't vaccinate against it routinely in children because it's not really a very routine exposure that a child could be exposed to. However, the COVID-19 vaccine has totally changed the landscape, right? This is the first pandemic that I've lived through and had a chance to really see how the healthcare field and how society has really changed. So posing this question has a lot of different implications to it. Well, first of all, let's talk about what this vaccine could mean for our children. So theoretically, right now, as of May 11, 2021, that means that if down the pipeline in the very near future, this vaccine does get approved for 12 to 15-year-olds, then potentially you could have a child that is fully vaccinated by even the end of June. That means parents could get their teens or tweens possibly back into somewhat of a sense of normalcy for the summer. Ball games, sleepovers, family reunions, traveling without the risk of potentially spreading, transmitting, or catching COVID-19, which could mean a big deal for a lot of families. Now, again, is this virus really a risk factor for children? Does it really affect them? Well, let's get back to if this virus is actually a big deal for these children, though. Sure, of course, it's definitely upended their social lives and their school lives, of course, but does it really affect their health? Well, since the start of the pandemic, more than 3.8 million children have been infected with SARS-CoV-2 virus, causing the disease COVID-19. Children can get sick from COVID. They can get very sick. Between March 2020 and March 2021, nearly 14,000 children were hospitalized with COVID-19, and 279 children have died. These numbers aren't to scare you. Really, they're not. I just want to let you know that children are not immune to this virus, as many people like to think. Now, of course, while more adults have suffered than children, and we have a lot of data to show why that could be, it's not fair to say that this disease is benign in children. Having a very safe, highly effective vaccine can help a lot of children mentally, emotionally, and of course with their physical health. So I encourage parents to talk with their pediatrician about how to get the vaccine as soon as their adolescent is eligible. As you know, we pediatricians are always saying children are not small adults, and they definitely cannot be an afterthought. We have enough vaccine to protect everyone, including our youngest generation. As a pediatrician, I want all children and teens in my practice to get this vaccine because I know it has the power to prevent them from suffering if they are exposed to this virus. And as an aunt to teenagers and adolescents, I want to make sure that all my nieces and nephews who do qualify for this vaccine are able to definitely get it to further protect themselves. Let's talk about the role of children in the community. Vaccines have the power to stop epidemics. That is huge. Children make up a pretty significant portion of the population, and vaccinating children should actually be part of our strategy to really stop the virus in its tracks and help halt propagation so that we're not really allowing it to transmit from one individual to another or possibly go home and hurt grandma or one of the parents in the home. Not to mention, we can possibly even prevent the emergence of new variants by really stopping propagation of the virus. What about safety, right? Is this vaccine safe? Of course, we've talked about this numerous ways when we talk about the COVID-19 vaccine in breastfeeding and the COVID-19 vaccine in pregnancy. I've done videos on those in the past and I will link them right here. You can absolutely go back and look at them, but let's talk about right now the safety of the vaccine for children. Now, Pfizer announced that the COVID-19 vaccine was 100% effective in their 12 to 15-year-olds during trials. So what does that mean exactly? So that means in the trial of over 2,000 children, half got placebo and half actually got the vaccine. Of the children who got the vaccine, which was about 1,131 children, none of them contracted the virus, as opposed to the 18 cases of COVID-19 that we saw in the placebo group, which made up about 1,129 children. All of those who were vaccinated produced an amazing, robust antibody response, and nobody experienced any adverse side effects. But what were the side effects? Well, some of the ones were pretty typical for any vaccine. Fatigue, fever, soreness at the injection site. Some people did have headaches, and some did have muscle aches, or what we call myalgias. But none of those are really outside of the ordinary. Now, of course, as I mentioned earlier, there are other trials coming down the pipeline. So we likely will see some data from 2 years of age all the way up to 11 years of age when that potentially comes out for emergency use authorization approval by the FDA, maybe close to the start of the 2021 school year. So maybe fall, September 2021, when we see the EUA get requested for that age group. And we'll find out what the potential adverse side effects after getting the vaccine were for that age group. But as of now, we at least know that everything for the 12 to 15-year-olds is nothing out of the ordinary. Let's say you decide to get the vaccine. Where can your child end up getting it, right? Your child always gets their vaccines with their pediatrician likely. So that's always an option. Some pediatric offices may actually be offering the vaccine. However, it's important to know and remember that the Pfizer vaccine does have some important regulations and rules about the temperatures that it's kept at. So a lot of pediatric offices are also working with local health departments to be able to vaccinate their teen and tween patients. Whichever location your child is vaccinated at, please make sure you communicate that with your pediatrician's office so that we can make note of it and actually note it in the child's immunization records. That's really important because these records might end up following your child from school to school, but also into college and later in life, maybe even grad school. Now, as pediatricians, we talk about vaccines day in and day out. So even if you do have questions and your pediatrician's office doesn't offer the vaccine, you can absolutely call and talk to your pediatrician or book an appointment and go over your questions about the vaccine. We understand the workflow and systems in place required to safely and efficiently vaccinate large groups of children and even ramp that up like in flu season. Not to mention be able to contact patients when they need to come back for their second or third dose of vaccines. Speaking of, for this Pfizer vaccine, there will be a 2-dose series. That means your teenager will have to come back for their second dose about 21 days later. Speaking of the other vaccine series, where does the COVID-19 vaccine fit in amongst the childhood vaccine schedule? Well, as a pediatrician, I believe all immunizations are important. And one thing that we have lots of data and statistics and evidence for is that during this pandemic, a lot of routine childhood vaccines have either been delayed or completely missed, including for diseases like measles or whooping cough, which can be deadly. So even if your child isn't eligible for the COVID-19 vaccine, let's say they're under 12 years of age, or if your child is over 12 years of age, is eligible, and you're just not ready to get the COVID-19 vaccine, please at least pick up the phone and call your pediatrician's office so that you can get your child in for their routine well check and caught up with vaccines. They're normal routine childhood vaccinations that they do need. Those are still very important. So talking about real life situations, right? Like your child being behind on vaccines, or if your child's staying at home right now because you're scared of COVID-19 outbreaks in the school. How does this vaccine and eligibility for this vaccine potentially change the landscape for your child going back to school? Well, one thing's for certain. School reopenings do not need to be delayed until all adolescents are vaccinated. On the contrary, we've talked about this in the past. Schools can reopen safely. provided certain measures are kept in place, like universal mask wearing, physical distancing, and making sure you're washing hands. The vaccine is just one of the many layers of protection, and probably until we get a larger amount of our teenage and childhood population vaccinated, we're still going to have to keep up with mask wearing, distancing, and that same thing, universal hand washing, which, by the way, washing your hands a few times a day isn't really a bad thing. Now, the decision to open up schools in person is made by the local and state public health authorities in conjunction with the school administration. So if you're having a high rate of community transmission, it might not be a good idea to send your child to school. We do know that community-based transmission can drive school-based transmission, but not the other way around. So school-based transmissions and school-based outbreaks don't necessarily drive community-based transmission. So that's why it's very important to look at the local numbers in your community and see how prevalent the disease is and see how many individuals have been vaccinated when making that decision to send your child back to school. Now, will the COVID-19 vaccine be mandated to enter school? That's not really something I can answer. I will say that when a vaccine has shown to be safe and effective, the CDC and the American Academy of Pediatrics, or the AAP, will make recommendations on how and when children should receive the vaccine. Basically how we've determined the childhood vaccine schedule right now, with the CDC's guidance on how and when the child, adolescent, or teenager should get their vaccine. However, when it comes to mandated vaccines for school entry, that's a state government decision. Pediatricians don't really play a role in that. Those decisions could vary state to state. I can tell you that as a pediatrician myself, I have received this vaccine. I got both doses in pregnancy, one in the first trimester, one in the second trimester. And when the COVID-19 vaccine is approved for children under 12 years of age, I will absolutely get my daughter vaccinated. I know children are low risk, but low risk is not no risk. Children make up about 13.8% of all COVID cases. And as mentioned in the very beginning, the virus can still be fatal in children. A year ago, children only made up about 3% of the total active COVID cases in the US. Now that number is rising, and children make up about 14% of the active cases. Why do we think that is? Well, a large part of it is because all the individuals who were at higher risk, we're talking about those with pre-existing health conditions, the elderly, they've all gotten vaccinated. So as older Americans have gotten vaccinated, that lowers the number of potentially susceptible individuals who could still get the virus. And it lowers the number of adults relative to the number of children. And remember, children up till now are not vaccine eligible. So by allowing our children to get vaccinated, we can further lower the risk for our youngest population. Now, of course, some of you may still be very hesitant, and that's normal. Absolutely. It makes sense. This is a new vaccine. This is a novel virus. We're constantly seeing variants. And again, this is the first pandemic I've lived through. I'm sure it's probably the same for you as well. And so to be able to raise a child, and you've been working so hard to try to protect your child, perhaps you're doing schooling at home, virtual schooling, perhaps that you've canceled all your vacations, or maybe you've basically not had a chance to go to any birthday parties, play dates, or functions. And it's a big step to make. And it's a big step to make to decide to get your child vaccinated. Again, this video is to really hit on the points about why it's important to vaccinate our children and how it can get us one step closer to normalcy and perhaps getting that fun aspect of being a kid back in our kids' lives again. I hope this video was helpful. If you have questions, make sure you ask them below. If it was helpful, give it a thumbs up and please do subscribe.